Bayoubuzz.com. Katie, please help me with your last name. I'm sure you ask that as often as I'm asked how to say my last name.
So it's Katie Vlietstra, and I am the Director of Government Affairs for the National Association for the Self-Employed.
Okay, so why don't you tell us, if you would, what is this National Association for the Self-Employed? Is it an organization for small business, or what is it?
So the National Association for the Self-Employed is an education membership association for the 22 million self-employed and micro-business owners in the United States. So a micro-business is 10 or less employees, and then of course your self-employed are your traditional sole proprietors who are running a business all across this great country. And we like to say America's smallest business, 22 million if you can actually. In fact, we're just reviewing the 2011 census IRS data, and it looks like the self-employed actually jumped just under 23 million. So a lot of America's backbone, the small business community, is really the self-employed. They make up about 76 of the entire small business community.
Well, that's absolutely amazing. What's the difference between a self-employed and say small business?
So the Small Business Administration definition of a small business is 499 or less employees. That's a pretty big swath of small businesses, and we say that with air quotes. And of course, all of those businesses are working hard. They're providing a product to consumers. They're employing lots of people. But when we really break down some of these issues, how they impact different sets of population, a company of 499 employees has a lot more resources that they're available internally. Whereas when you kind of drill down really to the 100 or 50 or 25 or 10 or less employees, those individuals that are running their business have very different questions, concerns, resources are limited to them because they don't have an in-house HR person doing payroll, or they don't have access to a full-time legal advisor. And so the National Association for the Self-Employed kind of provides some of that infrastructure that those small businesses need. So you can, as a member, you have access to what's called Ask the Expert. So if you need legal or labor or marketing advice, you can come to our experts and get that kind of advice without having to hire those people. We also have a very robust scholarship and grants program. So we like to be able to give some of our funds back to our members through a grant program. Because again, a lot of our members aren't able to take advantage of some of the bigger loan programs through the SBA, and they're having issues to a certain degree getting financing through just a community local bank because of their size. And so we're able to provide some growth grants and scholarships that allow our members who have already started their business to grow their business.
It's something I didn't know. I mean, really. So it sounds like really absolutely terrific opportunities. Well, we have the Patient Protection and Affordable Care Act signed by the President in March 2010. And some big things are about to happen October 1, 2013. So just globally, in terms of how that impacts everybody in this country, what can you tell us about it? I know there are people on both sides of this issue politically, and I'm not really interested in talking about the politics of it. As far as I'm concerned right now, it's more, okay, so this is a law, and what do we do?
Absolutely, and that is actually the perspective we take. We can talk some policy issues of things we'd like to see changed or enhanced in the bill, but really where we're at is come October 1, a whole new world of insurance is going to open up. Traditionally the self-employed are individual purchasers of health insurance. Again, a big difference between them and bigger business is that they don't have the employees, they don't have the big group health plans. They're in the individual market purchasing health insurance for themselves and their family, and if they're lucky enough or able to, for their employees. And so come October 1, when the individual exchange marketplace opens up, this is going to be the primary place that the self-employed are going to purchase health insurance. And we estimate right now there's about 6 million of that, almost 23 million that have no health insurance whatsoever. The other group of those who have health insurance have a mixed bag. They either are covered by a spouse because their spouse is employed by, a company that has an employer-sponsored plan, or they have a current healthcare product. The self-employed are very mobile healthcare consumers. They purchase healthcare often and early. It is the single greatest business expense outside of operating like the nuts and bolts of their business, healthcare. And so come October 1, we are going to see, and what we anticipate is many of those, almost 23 million, are going to go and check out the exchange. They know in theory, or we hope we've been doing a good enough job educating them about what this means, but the biggest thing that we have not been able to educate and communicate is actual price of these health insurance products come October 1. And so it's a big change. It's for the self-employed, they're used to purchasing coverage that sometimes is not necessarily entirely comprehensive or affordable. And so this is really going to be the first time that they as consumers are going to have access to a wider range of products that they can select and make a good decision for themselves, their family and their business. And so there are some great things. There's some other things that we're concerned about that we can talk about as you move through your questions.